I think as we focus on the technology of medicine, we focus on the use of technology to deliver evidence-based clinical practice, we're losing something. And what we're losing is the importance of recognizing that all of our patients and their families are fellow human beings, and we need to treat them with compassion, dignity, and respect. So my definition of quality medical care is different than the Institutes of Medicine because I went through major surgery at age 50. I lost all of my flight certifications. I was no longer able to fly as a commercial pilot. I was no longer able to fly as an astronaut. Lost everything. And it was really interesting when you're in the hospital and you put on the blue gown and you go from being a physician astronaut standing vertical to lying horizontal on a stretcher with this little blue gown that opens in the back, stark naked under this little blanket, and all of a sudden you're a patient. And I got everything back. I flew in space 4 years after I had my major surgery. But for me, I think what's interesting is it's individualized healthcare that exceeds desired outcomes, and the desired outcomes are defined not only by the practitioner, but by the patient and their family as well. So getting back to the computer analogy, that you really want to provide something that's meeting the needs of the individual, and in some cases the individual needs are going to be quite different between one patient and another. And of course, and consistent with professional knowledge, so consistent with evidence-based practice, but also delivered with dignity and respect. And I think it's absolutely fundamental to start thinking about how we in healthcare are starting to deliver quality-based medical practice. And I'd encourage you to use the words quality-based medicine, because if you start to use the words in the lexicon, then people will ask, how are we delivering quality-based medical care? Find any hospital CEO and ask them, do you deliver quality care at your hospital? What's the answer going to be? Of course, it's yes. Everybody says yes. The next question can be a little bit more of a challenge for them. How are you delivering quality-based medical care at your hospital? And that's where it gets kind of interesting, because some of them will, oh, well, actually you need to speak to the VP for safety and quality on that or whatever. But I think we need, all of us who are working in healthcare should be able to respond to how we're delivering quality-based medical care. In medical training, typically we focus on healthcare professionals as individuals, but it's really working together as a team that I think is so critical. And in fact, the take-home message for me with regard to working together as a team and how you do what the title of this talk suggests, attain peak performance in teams, is to create a culture. And the culture that we need to create in medicine is a culture of safety and quality, where we are relentlessly pursuing clinical excellence as a habit, something that we do on a day-to-day basis. And in the space program, we spend a lot of time developing and building the culture that we have for the astronauts. And fundamentally, organizational culture is defined here. It's a set of shared beliefs, values by members of an organization.